Welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change.
Well, hi, everyone, and welcome to Alzheimer's Speaks. I'm thrilled you can join us today. We're going to be talking about exploring alternative therapies to improve your health and wellness, especially when it comes to dementia. We're going to be talking with Dr. Sinicropi today, and I think you're going to learn some really, really interesting stuff. But before we go there, I want to give a shout out to Whittle Twiddle, our hand muffs that are just a great sensory tool. And they are a wonderful aid. So if someone is struggling with sundowning or having anxiety, this can just have a real calming effect. They also have a product called Adapt Wrap, which is ideal for people who might lose some of their mobility or strength just getting dressed. They have a great garment that really reduces combative behavior when you're trying to dress. It feels like a hug. It's for fall, it's, kind of fleecy, and so it's soft and comfortable, and it can allow the calm to come back both for the person wearing it as well as family or staff. It all secures in the back, so it's great too if you have someone who likes to disrobe, and that can help out with that. So enough of the housekeeping. Let's get on to our interviews. Well, Dr. Sinicropi, I am so excited to have you on the show. It was a thrill being on your show, and I really appreciate your time. I'm so interested in the work you're doing. And the work you've done, kind of the history, of where you came from. So if you don't mind, I'm going to have you introduce yourself to our audience because your background is just so vast.
Of course. And thanks for the introduction. And it was amazing having you on the show. I mean, Alzheimer's is near and dear to my heart. As you know, I had a family member that experienced it, so know all about kind of the perils and the difficulties of dealing with that stuff. So as far as myself, born and raised in New York City in the Bronx, eventually somehow found myself here in Minnesota, and as a profession, I chose to become an orthopedic spine surgeon, and I've been in practice now for 19 years. And have treated lots and lots of patients. So without, getting into that, the whole world of orthopedic spine surgery, really enjoy it. There's so many people that need help, people that have, scoliosis and spinal stenosis and all kinds of different conditions where their lives are ruined. And it's been an absolute honor to treat the patients in the Twin Cities, being a spine surgeon. But I've always had a deep general passion for wellness overall, and all started with myself, and my wife is big into it, and I started translating that into treating my patients through exercise regimens, but mostly through diet. And I've been doing this for a large portion of my career, but that's where it ended. I mean, that's really what was happening. I was always upset about seeing how sick my patients were, and just wondered, is this just an aberration, or is it like every sick person in the state of Minnesota comes and sees me and wants me to do something with their spine, but yet they have a million other things and are on all these meds and whatever. And so through an injury of my son, who needed some real help in getting back after a broken leg, I learned about a lot of different biohacking techniques and things that would be considered in the alternative medicine space or the integrative medicine space, and really became fascinated by it and started learning more and more about it. And once I was hooked and really understood that there was a massive amount of data behind all of these things that I had never really thought of, began to just really, I just kind of went back to the basics and made myself an expert in integrative health and biohacking techniques, and eventually with some other partners went ahead and opened wellness centers here in the Twin Cities called HyperCharge Clinics, and then expanded that now more recently to HyperCharge Health, which is a full service medical clinic, treating pretty much everything. It's sort of an alternative to primary care. We also do aesthetics there and things like that. But the main goal of it is to really help people that are stuck in the traditional Western medical system and are really looking for answers outside of what people like myself were previously, pushing on them, which is the kind of the standard Western medical training, which is just a small sliver of what is available for people to get their life, to really take their lives back. And so here we are now. If you had asked me 3 years ago, would I be sitting, talking to, Lori about, what's going on in the dementia world and things like that, I would have just not laughed. I would have said, what are you talking about? I don't know what you're saying. But here we are now, and I'm talking to all these amazing people like yourself about all kinds of conditions outside of what my main training was. But this is a topic that's near and dear to me. And, one of my first job, my first job that I had in the medical space was working in the neuropathology lab at Albert Einstein Hospital in New York City, where I did research, actually, primarily on Alzheimer's disease, and published. So I can't. It's really full circle. So it's really a pleasure to be here with you today.
Well, interesting. I'm going to have you define a couple of terms that our audience might not understand. There's a lot of people that really don't know what integrative medicine is, or the difference between Eastern and Western medicine. Right. Can you kind of try to sum that up for us?
Sure. So when we say integrative, it really is, a better way to say it, I would just call it, honestly, comprehensive medical care. And so when we talk about Western medicine, that is what is traditionally trained. I went to Columbia University, College of Physicians and Surgeons as a medical student. And that's why I always call myself the insider of insiders. I had the traditional medical training, and that is that we look at disease states in a very specific way. And so it just boils it down to this: what is the exact molecule or the structure that is not functioning well? And what do we have at our disposal to make differences in that particular structure? So for example, if you look at like the Western medical, like what are the hardcore things that Western medicine is doing right now in the space of dementia, right? And Alzheimer's disease, right? We're developing these drugs which target the specific molecule, which is this beta amyloid protein, and try to block it. So that's the molecular, right? We're going right down to the molecule. That's how Western medicine thinks. It's very mechanistic. Okay. Other types of things, Eastern medicines, which rely more on things like meditation and acupuncture and kind of whole body awareness. And if you look at right, we hear of things like chakras and energy medicine and all these other things. That is a whole body, holistic way of looking at things, which is dramatically different from Western medicine. And then there's all these other alternative things like biohacking, which is using things like photobiomodulation, which we'll talk a lot about, I'm sure, which is using light therapy to influence cells, or utilizing oxygen therapy. People know it best as like hyperbaric chambers. We do it a little different in our clinics, although we are going to start doing some hyperbaric medicine as well now that we're expanding. But those things, if you take those things, if you take the best of all those worlds and then combine them, that's what integrative health is. It's a whole body approach. And what I love about integrative health is that it doesn't dispense either with the Western medical ideas, because there are incredible drugs and other things that we need. Like, for example, for a genetic disorder, and that's a severe genetic disorder, it's amazing what some of the things that are coming down the pipeline, those are Western medical ideas, right? You can do all the meditating you want. If you have a genetic disorder that's going to cause your arteries to do X, You can meditate all day. It's not gonna, but the combination of it, of all these things together are ideal to really help patients. And in this world currently, where we have a massive chronic disease crisis, which is primarily spurred on by our lifestyle choices, including, nutrition, exposure to toxins, and so on. We can talk about it more. I'll just kind of wait for you to ask those questions. But when we look at it, these more holistic, all-inclusive ways to treat patients are radically, it's a dramatically better way to treat patients rather than to just tank them up on drugs and procedures, because that doesn't solve the root cause problem of what is creating these problems in the first place.
I so agree with you on all levels there. And there's so many people that don't know about all these alternatives. And, they've been told there's a lot of myths out there. It's just snake oil stuff. It's not working. And yet we're seeing more studies on these things coming and kind of fitting the medical model to get approval over here in the US, where in other areas of the world, it's just that's their standard, to go. But I think here we just, we want everything fast and quick, and we want a pill to fix it. We want that silver bullet. And, one of the things that I have seen during my work, especially through dementia and just with aging parents and things like that, is we're all more than a disease or an illness. And that personal piece gets missed so often, and little things become big things when someone's depressed. And,
Absolutely.
and a pill isn't going to necessarily make them feel purposeful in life. So how do we do that? What are the other things that we can bring in, and the social aspects? And I'll give you an example of what I mean in terms of the difference. As you know, I just went through a bout with COVID that kicked my butt for over a month, almost 6 weeks. And I'm not one that gets sick. I'm not one that goes to the doctor. But, when I went into urgent care a couple of times and then ended up in the ER, it was very matter of fact. People were nice, they were polite, but it was very matter of fact. But one of the differences I found is all 3 doctors that I saw had different spins on what I had, what I should be given, and in what doses. And that just kind of blew me away. I mean, they weren't even close to being consistent. And yet my symptoms really hadn't changed, other than getting worse as time went on. But I went into your clinic and they were so personable and just so kind. And every time I came in, hi, Lori, how you doing? And I mean, they remembered how I felt from the last time I went in to this time. And it was just like, I feel part. I mean, I feel heard. I feel included. I feel known and validated. And I don't always get that when I go to the doctor. And that makes a big difference in terms of how you feel about even being there, let alone getting treatment there, I think.
No, absolutely. And I mean, and that's great to hear. And I'm glad that you really felt included. And I think a lot of the things that I really am trying to get out, and not just through the clinics, but everything I do on social media, I'm writing the book and doing all these things, is the importance of, I'm a physician and I have patients. It's very important for us to be a team, okay? But I'm on your team, okay? This is critical. And I have an entire chapter in my book. I just finished the chapter on this, in fact, and it's just I get like very excited about it, because it's so, and people don't think like, I mean, people do, but I mean, when I say, I mean, generally, when you are the CEO of your health, okay? And so when you say, hey, Dr. Sinicropi, I want you to help me with this thing, right? You're making a decision on whether or not to hire me as one of you, or maybe your vice presidents in this category, right? So if you're coming to us for your COVID symptoms, you're like, hey, Dr. Sinicropi, I would love to hire you as the vice president of the COVID department in my health. But I am just there to facilitate. I'm just, our job as physicians, as nurse practitioners, anybody in healthcare. And I think that this is really lost on people, and it really bothers me. And it's exactly true what you said. When you go through some parts of the medical system, our job is to take all the knowledge we have and whatever, and then try to help guide you as best as we can with recommendations, suggestions, but is importantly to listen to what Lori wants. All right, you might have a certain religious belief. You might have a certain way that you think because your mom went through Alzheimer's disease and you're afraid of the medical system for whatever reason. Or you grew up in a household of, let's say, chiropractic doctors, and you're very anti them. It is my job to help to guide you in the best way possible, give you the options, not basically blow you off if you just say, you know what, I'm just going to treat with guided meditation. I mean, again, I might disagree with that. And I say, well, I'm very much a holistic person. However, you have this gene and we're worried about you developing this. So we have to do these things. My job, though, is to really get to know, for you to gain your trust as your vice president in your company. You're not my vice president in my company. It's the other way around. And that's what happens in this paternalistic kind of medical system. We really have to break those chains. Very bad for the people. But regardless, my job is to make you feel empowered. So when you see us, you see me, or you see anybody that's around. I mean, this is one thing that we absolutely demand from the people that are in our sphere. Same thing we do at my spine and neurosurgical company. We want you to leave feeling very empowered about your health. Just leaving thinking, wow, if I really feel like I have a good strategy, I can help myself. There's nothing better than feeling hopeful and feeling a part of your thing, rather than I just say, hey, Lori, you have this? Here's a prescription for your pain, and here's one, you're down because you've had COVID for a month. Here's a little something for your depression. Here's something for sleep. Here are 4 scripts. Just take these. We'll see you in a month. Good luck. Unfortunately, that's where we are right now, not to mention then not educating you on the things that are outside, but also you educating me. Hey, Dr. Sinicropi, I happen to be an Alzheimer's expert. I kind of, I have this big, group, and we're helping people, nationwide. Hey, do you know about this? My reaction shouldn't be, oh my God, another, and now what are you trying to do? My reaction should be, wow, that's very amazing. Can you send me some literature on that, or to guide me to your website? I need to learn, because guess what? I take your, what you've learned, your expertise, but just even patients with their own illnesses. Sometimes they're way more experts than anybody because they've dealt with it, right? And then take that and help other people with the knowledge that you've helped me with. That's the way these interactions need to be. And that's really what we are, the message we're trying to get across.
Well, one other thing that I'm going to say that you guys do really well, and I so appreciated this, especially after just coming off these other doctor experiences, was I get so sick of filling out forms or repeating my story. Your staff, they actually read my file and they know. And if they have a question in terms of even treatment, they're like, let me go just check that really quick. Yeah. And they're just on all of them, every single one of them. And I was shocked, how smooth and informed they were, and how they really I felt like they really wanted to learn what's working, what's not working, very conscious of, is this too much pressure? How's this feeling? Is this adjusted right? All of those things that typically you just get thrown someplace, you're given something and you're kicked out of the room and said, we'll see you at the next appointment type deal. Or, it's a very, very different experience. So I just want to give you kudos for that, because, and the other thing that I will say is your staff is all happy to be there. And that's a very rare experience too, because you can tell when people aren't happy in their jobs. And a lot of times they tell you, well, the system isn't what it used to be. And so that gives a patient a lot of confidence too, and comfort in terms of what's going on, even if it is something new that they're exploring. So Kudos to that. I do want to just touch base because this is a question I ask everybody, and that is, have you been personally touched by dementia in your own family or circle of friends? You had mentioned, that you worked for a neuro clinic initially and had some background there, but how about personally?
Yeah, so personally, and it's something I've shared with you before. I had an aunt who lived in Toronto. A lot of our families up there in Toronto that had really severe Alzheimer's disease. I mean, at first it was pretty slowly progressive, where she would forget stuff and whatever, and then it quickly progressed to she would get lost in the neighborhood and they had to go and find her and things like that. The family, we don't live there. Obviously, I was living in New York at the time, but we would go visit in the summers and just rapidly, progressed over time. And my last memories of the last time that I had visited there, I stayed there for a while. And, very violent, a lot of violent behaviors. The caregiver was really struggling. They had hired a full-time person to give her care at home before she ended up in the memory care facility, kind of for her last days. But it was very sad. The family was heartbroken. They didn't know what to do. They were very scared. They were very emotional. They really didn't have any resources other than, hiring this woman that would help out in the house. They just didn't know, what to do. And that's why it's incredible to see all of the, support, network that you're putting together, with people. I mean, I was touched. I mean, so we met. So for people that don't know, I mean, we kind of connected through social media because we're kind of in those same circles of just trying to help people, and that in the helping people circles, which I love. I've met so many amazing people, but it's so important what the work that you're doing and just trying to get people connected with the right that would have helped them so much. I mean, I'm just saying, I mean, that was a really, really hard time. And again, I was more of an outsider looking in. I mean, it was my aunt, so it was very sad because she had no idea who I was at the end, like no clue. So it was like talking to her. I mean, she just wasn't there anymore. And I know this is all near and dear to your heart, and they all experience it a different way, and all the families go through it different. So, I mean, that's really my experience, and so I can always commiserate with people that have it, and I have a lot of patients that have early, like they're early in their Alzheimer's, and they see me as a spine patient, and they're very scared. Now, the more I'm kind of back in the world of dementia now, the more I can talk to them about it and at least try to, allay their fears in some way, and I actually have something to offer them because of the things that we're doing and these like non-invasive, non-procedural options. I do want to go back and just address real quick about the happy employees that we have, because that obviously that makes me very happy to hear, because that's what we want. We want people to really be inspired. One of the most emotional moments that I had was a reaction of one of our employees to a patient that I had referred. And so I met this guy through my clinics, and I felt terrible. So he came in and he was referred. He needed surgery on his neck, and he clearly needed surgery. He has spinal cord compression. It's very straightforward. As soon as I look at the scan as a spine surgeon and his symptoms, I say, yeah, I agree with the doctor that referred you. They made a good referral, whatever. But I clearly, within 1 minute of talking to this guy, I'm thinking to myself, this guy has way, way more than a spine condition going on, because he was forgetful. He was a little bit labile. And so right away, knowing his history, I went into his, how they managed his concussion. And so he had a really bad injury in a truck about 9 months earlier. And he had sought some care for his concussion. It was just the usual stuff. Stay away from, a lot of stimulation and use the blue light glasses and be quiet. And they had referred him to some neurology clinics. They really, he hadn't had much, done. And that's a whole pet peeve of mine in concussion treatment. Anyway, after talking to him for about 15, 20 minutes, This guy was crying. He's like, this has ruined my life. I can't remember anything. I feel like I'm going to die. All these things were happening. Anyway, I said to him, you have a severe concussion. We need to treat you. We have options for you that you've not, I know that you haven't been made aware of these things because 99.9% of the population is not treating people this way. And so I said, let me refer you. I'm going to refer you over. Let's do initial consultation. We'll send you over to the clinic. We have a brain health program. We do all these things for brain care. And he was like, absolutely. Can I go? So we sent them over. I checked in I didn't check in. I didn't see him. I wasn't there. But when I checked in, I went over to the clinic and I asked our specialist, hey, how did so-and-so do? Immediately, when I asked her how he did, she started bawling. I mean, rivers. And I said, did I say something wrong? Did something go, like, is something wrong? And she said, oh my God, she's like, she was so thankful. She's like, thank you so much for bringing me into this world. She's like, this is the most amazing job. I said, oh, what happened? So it turns out we did the treatments with him. So he had transcranial laser therapy. We'll talk, whatever. I'll just wait, to get into that later. But he had light therapy to the brain. We put him in the bed with red light, and he had a little bit of green light because that's great for concussion. He did some oxygen, whatever. He made her cry, apparently, after his first treatment, because he said to her, he looked at her, he was all tearful, and he just said, this is the first time in 9 months that I felt like my headache was better, and it's the first time I could speak coherently without stuttering, and I know what I'm thinking right now. And he was like overwhelmed with joy, which made her cry. It was a big crying fest at the clinic, and now he's been treating with us. He's doing great. But that is so special and meaningful to me. And so that when people ask me, well, you're a successful spine surgeon, you've been doing this. Why are you doing all these things? All I have to do is tell them the story like that. And they're like, okay, I get it. I get it. Because we didn't have to do a major surgery on him. I didn't have to put, 10 screws in his back to get him feeling better. We put light on his head and gave him some oxygen, and he comes and he's like a new person. This is why I'm doing what I'm doing. I'm not inventing these things, but I'm looking and saying, oh my God, we could be helping millions and millions of suffering people to get their lives back, feel like themselves again. And here we are pushing drugs, and procedures without fixing potentially the root cause of the problem. So anyway, I digress, but had to get that story in because of what you said.
Well, and I heard many stories from your staff too of people's experiences that were just, life changing. And I'll say for myself, my first treatment, time that I was there, I couldn't leave right away. And they're like, well, why not? I'm like, I just have to sit here for a minute. And they're like, are you okay? Are you dizzy? And I'm like, no, but my eyesight got so much clearer, and and the colors were more vivid. It was like I was in a 3D thing. Yes. And I'm like, I just have to kind of get reset. But I was like, wow, that was unbelievable. And they're like, okay, take as much time as you want and stuff. But that was pretty cool. I just want to do a shout out in case anyone is just listening at this point and just kind of coming in midstream. We are talking with Dr. Sinicropi, and he is just absolutely fantastic. We've been talking a little bit, just really briefly, about his vision of kind of the medical model and integrative medicine and what he's seen as a doctor. And in the second half, we're going to really jump in and learn more about these different therapies. But you're definitely going to want to check out his HyperCharge Clinic, and it's just hyperchargeclinic.com. You can find him on Facebook, Instagram, YouTube, TikTok, and Twitter. And he's working on a book, so that'll be fabulous to get from him as well in the future. And they've got clinics, I believe it's in Maple Grove, Eden Prairie, Woodbury, and I believe you're opening a new one in Edina. Is that correct?
Yeah, so the Edina, yeah, thank you for that, the shout out there. But the Edina Clinic is our first hypercharge integrative health clinic, which again is a full service medical clinic. And so that is where really we can combine. So for people that are coming in the wellness centers, obviously we offer all these amazing biohacking tech, all the stuff that you experienced that we talked about before. But now, if somebody comes in and let's say they have clinical depression and they're on medications or they're diabetic or they're this. The good news is that we also can manage some of their medications and or work directly, for example, with their psychiatrist. So on the one hand, to manage everything, offering women's health, looking at men's health, hormonal management, being able to do change their cortisol levels, look at burnout. IV vitamin therapy. We also are doing full aesthetics in that clinic, and I know the focus of this is not really going to be the aesthetics, but the reason that we brought that in is because people not only want to feel good, but they also want to look good, and so we're doing all this high level aesthetic, medical aesthetic management. It's very important. So one group of people that is really it's really growing are these people that are on these GLP-1 weight loss medications, okay? And we do have a medical weight loss program, but what differentiates what we're doing compared to if people are getting their weight loss medications from a primary care doctor or just getting it online or whatever, is that we have a comprehensive strategy for weight loss, because one of the problems with the GLP-1s is you can get massive amounts of muscle loss, not just in the body, but also in the face, in the buttocks, in all these areas. And then people become depressed because they have massive, I don't know if you've ever, I don't know, I know people that are friends of mine who have lost so much muscle in their face, they look like a skeleton. They look like they're sick in a different way. And unfortunately, I mean, again, I'm only saying this because this is how it's called, but people call it Ozempic face. I don't want to pick on Ozempic. It's just one of the drugs, but they call it Ozempic face. And so very excited about being able to utilize different treatments, including radio frequency, electrical stimulation and stuff, to build back the muscles of the face in people that are on these GLP-1s. That's again the integrative model. We have to comprehensively approach these things, no different than diabetes. When we talk about dementia, you need an integrative model on dementia. It doesn't work if you just come in and somebody has to, here, take this drug. Okay, well, what about my social stuff? What about my nutritional? I mean, nutrition can make a massive difference in dementia. What about my biohacking? What about my biomarkers? Like, what are we looking at? People just, again, I'm very thankful that there are some Alzheimer's drugs being developed, and I'm sure they'll get better over time, but that does not make it the easy button. It is certainly not anywhere near a cure for Alzheimer's disease, nowhere near, with a lot of side effects. So again, to digress, that's why I'm so excited about the integrative model, and now we're able to offer it comprehensively with the full panel of medical oversight, including physicians and nurse practitioners at our Edina clinic. So, look forward to you coming in and checking it out. It's very different than the wellness center.
Oh, cool. Well, this is a perfect time to dive into, the clinic and the different types of therapy. So do you want to dive deeper into, you mentioned the light therapy, which goes by another name medically, but that's what the people off the street are going to call it. And tell us what that is and how that works. I mean, I can say from my experience, you go into a tanning bed, that's what it looks like, but you don't come out tan.
Yeah, I love it. So I think let's start with light there. So the scientific term is photobiomodulation. There is an entire science of photobiomodulation. I was not somebody that I was not familiar with photobiomodulation until a little over 2 years ago, where I became familiar with it, because I also was like, oh, those are tanning beds. That's nice. I had no idea. I kind of knew about red light therapy, but I didn't know anything about it. And now, I obviously have to make myself an expert on that subject. So photobiomodulation, let's break down that word, right? Photo, light, biology, living tissues, living cells, and modulation, to modulate, to make a change. And so when I talk to physicians or people in the medicals, if they're not excited about the word photobiomodulation when I break it down for them, I feel bad for them, because how could we not be not unbelievably excited that we, with the right wavelength and the right frequency, can change literally how our cells are functioning, period. This isn't this isn't a theory. This isn't like, oh, yeah, maybe it does. This is hardcore science, proven over and over and over again. We know it to the exactly how it works. And so for those, the people, I mean, I'm assuming most of the people that are, going to be watching this are kind of the lay audience. So let's talk about photosynthesis. How does photosynthesis work? Everybody knows photosynthesis. It's like, you learn that in first grade. They start talking, right, about photosynthesis. So the light hits the green, let's just say it's a leaf, it hits the leaf, and the light at a certain frequency. So sunlight is the most effective for photosynthesis. So it hits the leaf, it absorbs that light and those specific wavelengths, and then it creates energy, right? That's how trees grow, that's how plants grow, right? Try growing a plant with absolutely no light. Most plants don't. I mean, there's some that need the tiniest bit, but most need some. And there's other creatures, right, that we know about that light up and they can absorb light energy and whatever. And people are familiar with that, right? Phytoplankton, things like that. And so if you take that, if I ask anybody off the street, do you believe in photosynthesis? Obviously, if they say no, I think that we everyone knows enough about, okay, sunlight makes the trees grow. We get that. But then we say photobiomodulation, and we try to explain this. And I'll be honest with you, I think the lay public is a lot more open to understanding some of these things. I tell my colleagues, they're like, oh, that doesn't do anything. Well, why not? They're like, if it was that easy, everybody would know about it. Well, I don't think so. Just because you don't know about it doesn't mean it's not true. So let's talk about photobiomodulation. How does it work specifically? Because again, I wouldn't have any interest in this unless there was really hardcore science and data behind it. So when is specific wavelengths, and this has been studied for a long, long time. In fact, the Nobel Prize in 1903 was won in light therapy, and that was for a certain type of tuberculosis. And after that, we've known that light can modulate different processes. But now it's obviously a lot more advanced. And so when the light at certain wavelengths. And so when we look at what's called the near infrared spectrum and the infrared spectrum, and that's what you experience in the bed, it's the stuff you can't see. Red lights work too, the red light part of it, but it's the near infrared that is the best at penetrating tissue and creating these things. That light penetrates the cells and it gets into what's called the mitochondria. Now, the mitochondria, which many of you are familiar with, are the powerhouses of the cell. The mitochondria themselves have a cell wall, all right? So the cell itself has a cell wall. The mitochondria have a similar cell wall. That wall has something in it called the chromophore. And specifically, it's cytochrome C oxidase. That's a little bit complex. But anyway, that absorbs the light in certain wavelengths and specific frequencies. And you can titrate it based on what you're trying to affect. When it does that, it stimulates the production of ATP. ATP is the gasoline of the cell, adenosine triphosphate. It is the most basic process by which if your body stopped producing ATP right now, you would drop dead. That's it. It's over. That the battery's dead. I mean, literally, you're on E. Life has ceased. Okay, when we die, processes cease. And so we have to constantly produce ATP for our cellular engines to go. So we can dramatically improve the production of energy in your cells by shining specific wavelengths at specific frequencies on them through mitochondrial health. The other thing, mitochondria have their own DNA. I'm going to try not to get too science, because then we'll lose people and people will go and say, you know what, I'm going to just go do this other thing because this guy's losing me. But the mitochondria have its own DNA and almost has a mind of its own. And so when you stimulate that mitochondria through light therapy, the mitochondria then sends a signal to the cell, and I'm going to give the lay term. It tells the cell the following: get healthier, feel better, work better. Go repair all that other stuff. Throw out the garbage in the cell. Okay? Imagine that now working on the trillions of cells in your body. And one of my favorite cells are the neurons in the brain, which have the biggest mitochondrial density of all the cells in the body. And if we can improve the mitochondrial functioning and improve the health of those brain cells, imagine what we can do to improve cognitive abilities, to reverse, not completely, but improve, the things that people experience with dementia, but improve dramatically. There are dozens and dozens of studies: depression, anxiety, ADHD. I can go on and on. I know this is more of a talk on dementia, but again, the light therapy works that way. It also will work in all the cells. And so let's talk about things where it's clearly FDA approved. There's all these statements from the FDA saying, yeah, this is great. So if you shine the light, for example, on damaged like muscular tissue or fascial, whatever or tendons or ligaments, you're going to create an anti-inflammatory cascade of events that then helps to repair those cells, brings more blood flow in, do things. And so we can heal tissues much, much faster utilizing light therapy. Again, it's non-invasive. There's no penetration of anything into your body. There's no medication. There's no anything. We're just shining a light. And what we're able to do is repair, repair, repair. And you can see this anywhere from a petri dish to individual cells, to tissues, to total body organisms. There are thousands of studies on photobiomodulation and how it affects tissues, cells, and then organisms, including all the animal models and all the human studies now. It's beyond fascinating. And the potential for light treatment to absolutely revolutionize the way that we treat the human body through almost any disease, almost anything, using the right wavelength, the right rate, to at least help. Some things need a lot of drugs too. Some things don't. Maybe we can just treat it with photobiomodulation. So let's define. So we have light therapy. So one of the things that people always ask me about is those beds, right? The tanning beds. So that's what we consider whole body photobiomodulation. And so in a 20-minute session, in one of the beds we have, and I'm just using that as an example because we know kind of the specifics of it, you can impart 100,000 joules of energy into your body. That's a lot. Okay, that's a lot of energy at very specific wavelengths and frequencies. So then people will always ask me, okay, the tanning bed stuff, or hey, I can buy this thing on Amazon, or I can get stuff. It's all boils down to physics. And so it's very simple. And let's give an analogy. You're going to get a very different response, okay, in your own body if you take one Excedrin versus taking 10. It's dose dependent. And obviously, if you get too much Excedrin, then you're going to end up in the emergency room because you're going to injure your organs. But if you get too little, your headache's going to be there. You got to get the right amount. And so people ask me all the time, and this is very important for people to really understand. You're going to get benefit from red light, whatever the red light is. The difference is the dosing. So that's what our clinics are so, we're obsessed. And you know that because you went through the program. So we're obsessed with our protocols. And that's really like our secret sauce. We understand that for certain things, like for example, like for treating COVID or Lyme's disease or this or that, you need a certain amount of energy to be able to create a true effect. Yes, you can use low-level things that maybe you buy on Amazon or you go to some, gym where they might have a rudimentary red light bed, but the dosing there, it's not specific. It's a one-size-fits-all, and we have no idea. They don't have protocols. They don't say, okay, when you do this, we're going to progress you here, depending on how these symptoms go, depending on how your oxygen therapy goes, and this and that. So the dosing is huge. So I can tell you, like personally now, because I'm in this space, I'm getting approached by companies left and right. They want me to be their their spokesman for their knee device that you put on your knee and this and that. But the reason I don't do that is because the dosing on those is a tiny fraction of what we can deliver with the next thing I'm going to talk about, which is laser therapy. So lasers have been around for a long time. They're much more powerful than the light therapy, and we do have to be more careful with them because those things they're just powerful. So we use something called the class 4 laser, and it can impart very large amounts of energy into the cells. That, though, however, hits that critical energy level in that same thing. So you're getting the same wavelengths that you might be getting when you get in those beds, but it's very specific to a location. So that class 4 laser therapy is FDA approved, for example, for musculoskeletal problems. And so if somebody comes in and they have like a horrible sprained ankle and their leg is, looks like a coconut, laser therapy with the amount of energy that we can impart on that area can rapidly reduce the swelling, the pain, the inflammation, all those things, as opposed to if you just put it, like even in the red light beds, or you just put like a red light panel on I mean, that's going to take forever to create something where we can do it rapidly. I mean, people come in and they walk out with much improved symptoms the first time they treat with us, and then, on from there. Same thing as far as power of penetration of the laser to the brain. And I've had this discussion with Dr. Hamlin, who is the world's guru, on it, because they used LED lights to do a lot of their studies, which actually were positive, which showed improvement in cognition and blood flow and all these things. But you cannot get the same amount of power to the brain because the skull blocks it, right? So the more power you give to the skull, the more you're going to get across it. So what we know from preliminary studies and white papers, but I also know this personally because we've treated a lot of patients now with these things, is that the laser to the brain laser, you're going to get a lot more of a very rapid improvement in blood flow, cognition, how people feel, having that kind of experience that you have. It's like kind of a mild euphoria the first time. And the reason it's a euphoria is because all of a sudden your brain cells are working at their I mean, they're fired up. They're connecting with each other and they're doing all these other things. The other thing I want to mention on the photobiomodulation, and this is fabulous, and this is one quote that I always quote, Dr. Michael R. Hamlin, and for those of you that are watching this, he is he's a legendary, and he's now retired, but he's pretty much on every major textbook that's been written on photobiomodulation, and had a long conversation with him on our podcast, which is actually I haven't released yet. That comes out in a couple weeks, and that is that when you shine the light on the brain, if you can get enough light on the brain, it creates something called synaptogenesis. What synaptogenesis means is it can basically regrow the connections between those brain cells. And what people need to understand is most brain disorders and most psychiatric disorders and all these things, they come with dysfunction at the synaptic level. If that can be improved, especially over time with these treatments, we just know that they're going to improve. And it's fascinating. And the fact that this is not standard of care across the board is very bothersome to me. And it's something that I'm beyond passionate about. And I'm going to spend the rest of my career really trying to get these technologies out to the general public, because, again, low-cost therapies with very low risks. Why in the world are we not shining the light on every brain disorder that's out there? Whether or not it's effective in everything, I can't speak to that because we have to do the more studies. But why we're not doing it when the risk to people is it's close to zero. And again, this is not medical advice or anything like that, but it really is close to zero. So really quickly, there were 3 studies that were done. They were very large studies done on patients that had acute stroke. And they had red light therapy to their brains afterwards. Now, it was very rudimentary studies. Those need to be redone because they only did like one session in some of them. But what it showed is 0 side effects. I mean, and that showed that even in the worst of conditions, red light did not like cause people to have seizures or anything. Because people always ask me, "Hey, is it safe?" It's extraordinarily safe. And the people that are behind this are, for example, the Harvard lab that does, Dr. Casano, that I've become friends with, that does a lot of these red light treatments to the head, Dr. Hamlin, other people across the country that are doing this. Oh my God, they put their names and their reputations behind it. They're like, the safety profile is incredible. And so that is all of our frustration why are not, like, for example, in Minnesota, why is every Alzheimer's patient at least not having a light shine on their brain? Worst case scenario, we shine a light on their head. If it doesn't work, so difference is if they come in and I say, hey, the company called me for the Alzheimer's people and they said I should give all of you guys this drug. If I give them that and a bunch of them end up having and again, I'm very pro the drug. I really hope that they really help people, but they have serious side effects. And so again, we have to weigh one of the things, what are risks and benefits of all these things? And if something has potentially big upside and very low risk, why are we not pushing those things? That's the question that really needs to be asked. Why is that not being pushed?
Oh, I totally agree. And, in both of these therapies with the light and the laser, you're talking about, decreasing the inflammation, increasing, cellular, getting the blood flow, the oxygen. All of those things are so extremely important, for dementia, but really for our bodies in general. I mean, it's almost to me like, it should be like a 101 book for dummies type thing, because if your body is healthy and getting the right things to begin with, you can fend things off and or correct. And so to me, it's extremely frustrating that these things have been shut down, and they seem to, in my experience, been shut down by big pharma, not wanting these alternatives to be pushed out. Just kind of the same with with the marijuana use and stuff for pain and things like that. I mean, I've heard of that for years and years, and people are like, I can't even talk about it anymore, or it destroyed somebody's career, over this stuff. And is that true? And in fact, I don't know. It's secondhand knowledge, but it just doesn't seem right. And yet, I get so tired of the commercials with the whisper at the end for 30 seconds of, and you can have diarrhea, or you can have stroke, or you can have brain bleed, or you can have this, you can have that, you can have this. And it's just like, oh my gosh, and it's, they're talking fast and they're talking soft. And so half the people can't even hear it, and the print on the labels is so small that it's hard to read without a magnifying glass for most people. So they don't really know. And I don't think it's really talked about. And that's what I'm hearing from people who are even getting these prescriptions from doctors. They're like, well, I didn't know that. No one told me that. And it's like, yeah, go back and read it, and then the cost, like you said, is so crazy high with all of this stuff. And yet, some insurance is covering it, but that's been a push and shove where, what was it? 3 people from FDA quit their jobs, not wanting to approve some of these dementia meds. And yet it got through again. And then they're mad because people aren't taking it because of, the press that it got. And so then they lowered the price a bit, but it's still out there. It's still being pushed, and people still don't understand, some of the potential consequences with these things. So it's very, very frustrating. And something like, these two things, like you said, it's kind of a no-brainer. The risks are low.
Literally.
Yeah. They the research is gathering, but I don't feel like you're as like with, and again, this is my personal opinion, and some of the big pharma is going to hate me for saying this, but I mean, I feel like right now, some of the prescriptions that are out there, we're doing trials without calling them trials by prescribing this stuff because they don't really know. And just seeing, and we're seeing that, with many of the drugs, not just in dementia, but in other things, where all of a sudden, 10 or 15 years later, this can cause heart conditions. This can, they pull them off the shelf, and I don't like that. I really, I have a big issue with that.
Yeah, there's there's actually a few chapters in my book devoted to why we can't make headway. And you're absolutely right. And it's not about big pharma hating us. It's about just telling the truth. I mean, we really have to tell the truth. And again, the reason that I'm really starting to penetrate in a lot of circles is because I don't come from this world of these other alternative therapies, like where I grew up in it. So they're just like, oh, you're just preaching, the stuff you know. I mean, I'm an insider of, I mean, literally, I mean, trained at a hardcore Western, medical institution, world-class institution, was taught by some of the most famous people in the world. Like, I mean, literally. And then, went on to practice in traditional Western medicine. And then, running our Midwest Spine and Brain for the last 10 years as an executive, as the CEO, I sit down with, almost every CEO in town here, all their management teams, insurance companies, all these people. So I know the insides of what the motivations are, what the financial incentives are, and this and that. You're absolutely right with what you said, and it's a huge frustration. And I'm sure when my book comes out, they're, I'm going to have to be just making sure there's not, the same black car following me everywhere I go. I mean, honest with you, but I'm just telling them, I'm just saying what I see, but clearly, there's obviously going to be a pushback when we're talking about alternatives to traditional treatments, especially when they're effective, because that you're literally taking billions of dollars out of the pockets of these organizations. The same thing with big food, right? I go crazy on big food and their advertising to kids and all this other stuff. And yeah, it is what it is now. I'm not the only one. There's a lot of people now calling it. So it's not like they're not going to, I hope they don't single me out. But it's just, I have to tell the truth. I can't unsee what I've seen. I want to give you an example. This is why I get so upset. So I did a lot of research on the new Alzheimer's drugs, just research, like personal research, because I wanted to know, so that when people come to me and say, I have Alzheimer's, should I refer? So it's interesting. They're interesting drugs. And like I said, this is something that goes back to before I even went to med school. I spent all that time at Albert Einstein in the neuropathology lab studying Alzheimer's disease, and primarily Alzheimer's, some of the other dementias like Lewy body dementia, but specifically Alzheimer's disease. That was the focus of that neuropathology lab as far as their research. But now, so we look at those drugs and we know you can have brain inflammation and all kinds of horrible things happen. Now, it did improve at the margins, some of their cognitive decline and this and that. But that's fine. And again, I'm not anti-pharma that way, because I think we do need new innovative drugs, because people have horrible things and we want to be able to treat them. And that's great. And there's a lot of people that'd be dead if we didn't have some of these pharmacological agents. I mean, that's just the truth. The problem is we need to look at those with all their side effects and then compare them to much safer things like photobiomodulation for the brain. Now, you can't just do random photobiomodulation. I mean, we're very serious about our protocols and techniques and talk to people in the country and have refined our and we'll continue to refine them over time. But let me share with the audience this. We know this for a fact. So the way that they look at that is decreasing the amount of the collection of these amyloid plaques in the brain, right? That's how they quantify that. So they say you reduce amyloid plaques, you do this and that. So obviously those things start with animal models and then they go to humans and then they publish what they publish. And frankly, the audience should know some Alzheimer's drugs have been taken off the market because of their side effect profile. I mean, I know you're aware of it because you deal with these families all the time. If you look at the animal models, so for example, there is a mouse model, which is an Alzheimer's model, crystal clear. This is hardcore science. Again, this is not Dr. Sinicropi wanting to be like, oh, I'm so, whatever, I'm going to get, whatever. If you look at the Alzheimer's model in the mouse, you give them light therapy. It's crystal clear that it reduces the amount of beta amyloid deposition. Crystal clear. Crystal. It's not a disputable. It's there. I can send you the studies. It is what it is. So why are we not doing the studies specific? Why are these companies not doing studies saying, you know what, instead of comparing this drug to this other drug or to having nothing, why don't we compare this Alzheimer's drugs to the same people and do either brain scans or whatever you're going to do, biopsies, whatever they decide to do, or just, spine. A lot of A lot of these studies are based on the amount of amyloid you have in your spinal fluid. Why don't you do those studies? Why don't you compare photobiomodulation with those drugs? Okay, that takes, yes, I know it takes millions of dollars to do those studies because they're very big studies and they have to be done. They're not done because let's imagine this world. What if photobiomodulation with almost no side effects is superior to those? That's the end of those drugs. Gone. It's over. No one would, right? You would never tell somebody to be on those drugs. And again, I'm not saying that this is not medical advice. I'm just saying that why would you do that? In this environment, though, my frustration is that why is every neurologist, when somebody's diagnosed with Alzheimer's, not immediately getting the light on the head, the light on the brain? Now, I'm using Dr. Hamlin's words. He's kind of an idol for me. He's a brilliant human. He's like, the faster we can get the light on the brain with these brain diseases, the better it is. Period, dot, end of story. There's nothing to talk. Why? It dramatically decreases inflammation, right? How does Alzheimer's work? You get these deposition of the beta amyloid in the brain. You get these things called plaques, and then you get these all this stuff. We don't have to go into it. That's what I did my research on. But that then causes inflammation in the brain, which kills the brain cells. That's how it works. I mean, that's the rudimentary way. I mean, it's more complex than that, but that's how it works. If we have something, if you shine the light on the brain and it's crystal clear that it decreases inflammation, it improves mitochondrial health, which is also dramatically affected in Alzheimer's disease. It improves blood flow. It improves lymphatic flow. Why on earth is everyone not getting that? Even if they want to treat with traditional Western stuff, why is that not part of the protocol? Why? Because people are actively trying to suppress this message from getting out. Again, and people can throw all the daggers and arrows at me that they want. I am pushing non-invasive, non-procedural, very safe options. So you can't say, oh, you're shilling this thing and you're going to kill people because, they're going to have this horrible side effect. No, that's not part of it. That's not even part of the equation. The only thing they can really say is, oh, you're pushing this and maybe it won't help. I'm sure that family members of people that have this disease that are hearing something like this are going to think, because they all do. Every person that has dementia, when the families are in there and I talk to them about this, right away they're like, oh, we want to try that. Of course you want to try that. I'm not like, hey, let's do this injection. It might kill you, but let's try it because grandma might remember, who you all are. I mean, no, we're going to put light on your head. We're going to give you oxygen. We're going to do these other things. So this is why I'm so passionate about it, because the counter argument to what I've clearly seen. And again, I'm not doing a lot of this stuff. I'm talking to the guys at Harvard. I'm talking to Dr. Hamlin. I'm talking to other guys in the country. These guys have been studying. They're frustrated. They're frustrated out of their minds that this stuff is not whatever. So that's why I'm deciding to use my frustration, my position in life, but mostly my Bronx voice that doesn't stop talking. And it's just like, well, maybe I can break through to people's minds in a different way and do it in my brand of ways and really start breaking through, because ultimately I just see I'm a guy from the Bronx who happens to be a surgeon and has some titles, but I come from these I come from these backgrounds. I've dealt with dementia in my own family. I just whatever. So if I can get this message, if nothing else comes from this podcast other than people enjoy hearing us together, because I really enjoy talking to you. If nothing's like, oh, these guys are fun to listen to. If nothing else comes from it, I want people to at least have light therapy from either our clinic or wherever. I mean, we're really the only ones that are doing it in our way, but at least consider it for your loved ones, because I'm telling you, because the risks are low. What have you got to lose by trying something which I deeply believe is highly effective at improving cognition? Sorry, that's there's certain questions just going to go off on these these long tangents.
No, I totally understand. And there are so many things. I mean, that's kind of why I started Dementia Math, was there are so many options people don't know even exist, and what I've also found over, my mom lived with dementia for 30 years and she's been gone like 10 now. But more and more people, families and people living with dementia, are getting more educated, and they're bringing stuff to the doctors that the doctors have never heard about before. And it can be from treatment to support groups to all different types of things that they've never heard of before. And to me, that is one of the ways that we will make change, is because it's not taught in conventional medical schools. We need to be able to get this stuff out there. And so what I have found is the families that are listening, the individuals that are diagnosed, especially in their early stages, they're like, might not be able to work, but they're looking for options. They're looking for information, and they're just scouring, the internet, but what's safe and what isn't,
Exactly.
can be kind of scary. And what you can buy off Amazon that says it's doing the same thing as the clinic, we all know it's not doing the same thing as the clinic. It's kind of a lookalike that's not
Yes.
type deal. And so people need to understand that as well. Now, in your clinic, I also did, some oxygen therapy, a couple of things with that. And then there was one where I laid on a pad, and then I had kind of a pad on my chest that was pulsing and stuff. Can you talk about those two options as well?
No, absolutely, and it's interesting. So oxygen therapy has been around for a long time. So for those of you that are listening to this, you're probably most familiar with the hyperbaric oxygen chambers. It is very big amongst elite athletes and things like that. But in medicine, so I was exposed to hyperbaric oxygen a long time ago. Actually, the first rotation I did as a physician was at the burn unit at Cornell, because we would do some stuff at Cornell. Even though I was at Columbia, we'd go down to Cornell. So I was spend time in the burn unit. So hyperbaric oxygen in burn patients and people that have non-healing wounds. Hyperoxygenating those tissues is highly anti-inflammatory and can absolutely help to create wound healing and just healing of tissues in general. So when you look at hyperoxygenating the cells, it also, when you do the oxygen therapy, it dramatically improves the use of the red light therapy. That's why we combine them, because when you give red light in the presence of high oxygen, or your body's more hyperoxygenated, you actually produce more ATP. It's actually fascinating the way they all work together. And that's why we have these very specific proprietary protocols for all the things. But oxygen therapy is one of the most important things that people can do to improve their overall health and longevity. There's all kinds of longevity studies out there, but as far as lifespan and health span, oxygen therapy is one of the most important things, something that I do personally. Again, I'm not just somebody that's like push. I mean, I do these things all the time. I mean, it's very, very important. And there are studies clearly showing improvement in cognition, in brain function, in blood flow, in dementia patients, in the presence of high oxygen. Most of those studies are done through the hyperbaric oxygen chambers. We do something called EWAT, which is what you experience, which is exercise while under oxygen. Different people do it at different stuff. Sometimes when people have more brain related symptoms of stuff, we have to just take it easy with the over exercising them, because they're going to feel sick. But we give high intensity oxygen while people are doing some exercise. Now, whether that's a recumbent bike, whether that's a regular bike, whether that's the shake plate, whatever, we want your heart rate to go up so your tissues go into an anaerobic state, and then we hyperoxygenate it. It's a way to recreate that hyperbaric chamber experience. You only need it 10 minutes, 3 or 4 times a week, and it's so dramatic at improving your cellular health. So oxygen therapy is incredible. And the studies absolutely support using oxygen therapy for people that have dementia, especially early onset, because you really can improve cognition. Then the same thing with pulsed electromagnetic frequency. So I was exposed to this early in my career as a spine surgeon, because we use it to help to regrow bone. So what you're doing with pulsed electromagnetic frequency therapies, you're putting people in a magnetic chamber. So even though you're laying on a thing, you actually have a magnet around you. So there's the little things that we could put. We don't do it anymore, but you can show people that you're actually in a magnetic chamber when you do that. It's just kind of a bubble around you that device creates, and that in itself can change the basically the electrical charges along cells, make them more efficient, make nerves work better, but also have studies in pulsed electromagnetic frequency, both in animal studies and in human studies, that show improvement in cognition with using PEMF, or pulsed electromagnetic frequency. And then the other thing you experience, which you didn't mention, and I'm being brief with these, I could talk about all of them for hours, but what's called nano-V, very interesting. It's called structured water therapy. This one's a little bit more complex. It took me a while. It took me 2 hours with the CEO of the company and a lot of research, and a lot of them, I made them send me everything they had on it. Basically, people are familiar with this concept of like free radicals, or things like, we'll just use that. These are things that we associate with inflammation. Our body is basically what we call a servo mechanism. Basically what it is we have checks and balances, right? So it's just kind of like, for example, the way we handle blood sugar. If you drink a big thing of orange juice, what does your body do, right? It wants to produce insulin because your blood sugar's up to bring it down. Same thing. The way that the structured water works is you structure water in a certain way, and you see the things bubbling up, and then you breathe it in. What it is creating is a tiny, tiny amount of these free radicals. In high amounts, it's going to make you like inflamed. In small amounts, though, what does it do? It tells your body, hey, man, there's these free radicals around, boom, and all the mechanisms to go anti-inflammatory happen. So we're giving it to you in a dose that doesn't create inflammation, but rather kicks in all of those mechanisms to create a highly anti-inflammatory environment. And imagine that, right, combined with all the other pillars. We call them our 5 pillars. But the cool thing is I don't believe anything. And so I need to see it with science. So yeah, I got all these, there's studies, some of them are companies, whatever, sponsored and whatever. I'm just skeptical, because if I put my name and my thing behind something, it really has to be real. So what do? We did it on our partner. So we had an electrophysiologist come in, right, who has no idea how this machine works or anything. And so we put the leads on Tram's head, and we looked at the tracings of his brain, quantitative EEG, and something we do in our clinic for our brain patients. So we looked at a quantitative EEG. The first thing the electrophysiologist said is, your brain is an absolute mess right now. It was the end of his day. He was feeling very tired. He was in a little bit of a brain fog from fatigue, all this stuff. And he's like, it's disorganized. So basically one part of his brain was not talking to the other part of his brain. Very disorganized. Just doing one modality, not red light, not oxygen, nothing, just doing that nano-V device in 3 minutes. And we have all the tracings recorded. We have all this stuff. Just in 3 minutes, his brain exploded with new energy. The connectivity between the lobes of his hemispheres of his brain exploded. And then it slowly rose after that. But just in 3 minutes of doing this stuff, he had an amazing improvement in the way his brain is functioning. And so it's just fabulous. That's why, so in learning about all these things, that's why we decided this has to be one of our pillars. This has to be a staple of what we're doing. And what you said earlier was right on the money. I strongly believe that these pillars that we are doing, when done in the right way, when done in the right sequencing, and again, we're working on all this. This is a new science. It's a new science of combining all these things. We are the ones that are going to write the articles on how they all combine, and we're using AI and all these other things to figure out all these data sets and what is the most ideal thing. Like, for example, in Alzheimer's, in cognitive disease, we know that certain frequencies of pulsed electromagnetic frequency are most effective at improving brain function, because those studies have been done. They're done in animal. We just have all that, and now we're just titrating it all together. But these things in together should be the baseline for people. And that's why we coined that term, recharging the human battery, because we recharge everything. We recharge our computers, our phones, all these things. These are ways to recharge ourselves, to work more to work more coherently, more functionally. And in the world of Alzheimer's disease, these things all together will get people's brain functioning better. And we're not just going to say it. we are going to show it by one, like, asking people and looking at questionnaires and things like that. But also when people go in our full brain health protocol, then we can say, okay, your quantitative EEG showed this, your brain was working this way, because it's pretty easy to see how, brains like the dementia brain works. And then 3 months later, now your brain's working like this. So again, we also doing it through asking people what their levels are. And we do all kinds of testing on this stuff, but hardcore science will prove out how all the modalities in conjunction can make a big, big difference in people's lives and their overall body health, but also their brain health.
Well, it's really, really exciting. Now, with these modalities, is it covered by insurance? Do you see it being covered by insurance in the future if it's not now?
I think that's a great thing. I think that eventually there will be a time where these things are covered by insurance, because even though for many indications, like for example, light therapy and laser therapy, those are those are FDA approved. There's a position statement by both the FDA and CDC pushing them, but yet they're not covered because there's a lot of other forces behind things not being covered, as you know. And so these are local. The thing that is most frustrating is to the insurance company, their spend on our modalities, it's peanuts compared to other stuff I refer people to. I'm a spine surgeon. I send people for complicated injections and procedures and, give medications. That's that you can treat for years as far as if I'm an insurer. I'll tell you who's liking our modalities and who is covering a lot of the times is workers' compensation. Why? Because they're smart. Because how does workers' compensation work? The quicker we get them back to work, the less we spend, the better they do. So they love us. So they're like, oh my God, if you can get their shoulder pain better or their knee pain or their concussion better faster, of course we're going to pay for your modalities, or we could send them to Yay Clinic and the spend is 10 times more. So it's great. But what I will say about the coverage issue is obviously we're going to keep working very diligently with I went and lobbied in DC for this stuff. Not that that's going to do anything. That nothing gets done in DC right now. But I'm going to continue lobbying to insurance companies and to other things. But what I will say is this, and I talk a lot about this on my podcast, the radio show, all these things, is that in our society, and again, listen, I'd rather it all be covered under insurance, but in our society, outside of medical care, almost everything else, okay, and car insurance, let's just say car insurance, but outside of everything else, people understand that when you want to get the best service, the most effective service, you're going to pay something for it, right? If you want to get the best tree service, with all the bells and whistles, and you're not a tree expert, obviously you're going to pay for the tree service to come, and you're going to get the best company that you can. You're going to get arborists to come out and the pest people and all these other things. People have to understand in medicine, and unfortunately, I'm trying to change it. This is the purpose of the book, and this is the purpose of everything we're doing. Unfortunately, I was done, and I am done treating to people just because the insurance company tells me that's what's approved. Because then I'm not giving people the full integrative health, because most integrative health clinics, the ones that are doing everything, a lot of it is going to be, it's going to be based on cash pay. And we try to make it as affordable as we can. But the question to people is, would you rather make the investment in your own health and well-being? Again, we're not asking you to invest in a surgery or having high-level procedures where it's costing some ridiculous amount of money. Are you willing to invest in something that is safe, relatively low cost, compared to, other things that they might spend on? Or would you rather stay in the traditional medical model and get stuff that your insurance company covers but has side effects, maybe is not the most effective thing for you? I have this discussion with my patients with spine care all the time, and I've said this a million times on my social stuff. I literally sit there with patients who are angry with me for not doing a spine surgery on them. Meanwhile, I've been doing it for 20 years, and I am telling them that these low-cost therapies are going to be so much more effective on them. They don't have to go through spine surgery. They don't have to. And the reason that they are insisting on having surgery because they're in pain and they don't want to spend the dollar out of their pocket. They just want to have it done. And I have to explain to them that the risks are so much higher for what they're asking, especially if I don't believe it. And obviously I don't cave in. I'm only going to do it if I feel like it's the best thing to do. Yeah, they can go somewhere else if they feel like my opinion is not one that they want to hear. But think about that. That's what we've become as a society. We'd rather be cut open and have these major surgery than go get laser therapy and oxygen therapy. I mean, this is how brainwashed the American public has been. And we as a medical community have done a great job in brainwashing people. Pharma, big food, big ag, great job in brainwashing people that they need these things to be able to survive, that they need those drugs, right? I mean, think about it. I mean, think treating depression, anxiety. That's like, 3/4 of our population is experiencing things like that. It's awful. Is it better to just put them all on expensive medications? Or is it better to look at alternative therapies, including nutritional therapies, behavioral changes, lifestyle management, and then biohacking, all these things we can do to make a dramatic improvement, not to mention when you look at all these other conditions, and now we're talking about what's covered and what's not covered, a lot of the really high level biomarker panels and really getting to the root cause of what's wrong with people, it's done through integrative health and naturopaths and all these other people that are trying to make a difference. Some of it's not covered, but we're getting to the root cause. So I, as a physician, I feel so empowered by not being limited to having to sit there and only telling people what their insurance company is going to cover. Now I just tell them, I was like, yeah, they'll cover this, but this is better for you. So this is what I'm recommending. So I hope it goes this way. Again, in the future, I do hope that some of these things are covered by insurance. But in every other aspect of life, you kind of get what you pay for. And so that's kind of what I just have to tell people. If they want those advanced root cause analysis, sometimes they do have to leave the traditional, Western medical model. I don't mean leave it completely, but at least seek care and opinions outside of it, and then you are fully informed and you and your families can make a decision, right? The other thing I just want to say is we are making a concerted effort to really think about how to bring this to a much larger population. And so that is really looking at, we just had meetings with a couple nonprofit organizations recently, and then we are also going to do a financial hardship program for people where they can apply for internal grants that we can help them get through the process if they don't have that ability to do it. And I've noticed that, whatever, but more frustrating to me are the people that can pay for it and they rather have medications and procedures. It drives me, it just like that keeps me up at night. And that makes zero sense. How brainwashed have people become? That's my point. That's what I would say. And I know that you know how brainwashed people have been with certain things.
Well, yeah, and it's not just people. I mean, it's our organizations, it's our government in terms of their structure. Like this would be great to get to CMS, who has developed the dementia guide, where the whole point is to keep people living at home, get them less services, so that they need less services. They should be engaging in a study in this. I mean, it's an 8-year program that they rolled out. It's very minute. There's only 90 clinics in the nation that have been approved for this program. There's going to be another 300 online who have to get up and running. And but this is something that they should consider. They're complaining on what a drain dementia is, on our system for the cost. Let's look at some alternatives. And I think there would be a lot of people that would be more than willing to step in and try this as a formal study. If the government would back it. But a lot of those studies go through NIH, and they seem so tied into the whole pharma reg. I mean, even studies, I'm a big social model girl, like look at the memory cafes, look at art therapy, look at this, look at that, and those things, nobody wants to touch those. They finally have been stepping into those, but once you give people purpose and connect them to community, which a lot of times they lose, it's huge. And so even like I said, coming into your clinic, I felt like I was part of a community. I didn't feel like it was just a doctor's appointment, at all, because all of them, it's not just the person who's working with me, but it's all of them reaching out, going, how are you doing? And, blah, 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 blah. And really listening. And so it's, hopefully that will change and more people will get out. And, we hope to help push that out as well. This has just been a fascinating conversation, which I knew that it would be. Is there any last thing that you want to tell our audience at all?
Yeah, I mean, I think I would close with this, which is my biggest one, and I brought it up before. Everything that myself and our organization and those that I'm trying to get in my sphere, like yourself,
Mm-hmm.
what we really want to get out to caregivers, to the people themselves, whether it's dementia or whatever else you're dealing with, is you have to be the boss of your own health. You have to understand you can't, that just having that empowerment is so important. And that's why I continually over and over use this term, be the CEO of your own health. And that's everything that our clinics, are about. And I really want folks that are watching this, or that you're connected to, and are just suffering through any chronic disease or any other things, become as much of an expert as you can in that thing, but also look outside of the traditional avenues. I had to do this too. My mind, I was one of you too. Anybody that's watching this that's somewhat skeptical about the things that we talked about, even though, Lori, you yourself, became randomly, you became a client because you just happened to have COVID around the time that we met. I'd love the opportunity for you to engage with us, learn more about what we're doing. And again, the nice thing about our community and our clinics and what we're doing, it's not all about just like the HyperCharge clinics and doing this and that. I want to be very supportive to other clinics that are doing similar things. I want to help other people in the communities. We want to get involved in the memory cafes and on all these other things when it comes to Alzheimer's disease. And as I've told you before, we've already talked to several nursing home people and memory care people about the possibility of bringing these modalities, even when it's later stage, into helping them, because we know that it helps. Is it going to help 100% of the people? No, but it's going to help most of them in some way. Is it going to be 20% effective, 40% effective, 60% effective as far as improving symptoms? No, but 20% in somebody who has dementia. What does that mean? For people. And that's why it's special. So that I want to support clinics nationally, internationally, that are doing the research, that are doing the work. And we are so passionate about it. So hopefully you get from this how passionate we are about helping people, not healthy people. We would love to help healthy people. We're great for recovering people and recharging your battery and feeling amazing. I do it all the time and I feel great doing it. But our real target market are people that have these chronic conditions where the information is so jumbled up. It's such a difficult maze to navigate. And Alzheimer's is in that bucket of one of the most difficult things to navigate. And again, thank you for everything you've done on your end to help people do that, and whatever we can do to help these people really, impact their lives, improve their cognition, help their family members, alongside. And again, we're in parallel with your other, physicians. If you have a great neurologist, that's awesome. We love that. We want to support those people, but we also want to be able to provide those services for you. And like I said, generally, yeah, there's a cost to them. They're low cost compared to most things, and most things that are done in the medical field. Obviously, very low cost, but still, it's a burden to some people. But what is it worth to get that family member or yourselves, if you're suffering from any chronic condition? What is it worth to you to improve your health, your well-being, and then be part of our community? Because it really is a community, and we are now in the process of like the stuff you're doing. We're going to develop these forums now where our members can really talk to each other and say, oh, you had this, oh, you did these things. How did your green light go? How did your transcranial go? So it's all about this community. So I really want to continue to develop the community. I'm so grateful that I met you, Laurie, and love to be more and more part of your world and your community and helping all those incredible families that you're helping. So I would say that's it. That's kind of my closing argument here.
Well, I wish you would show a little more passion with it.
I'll try on the next one. Maybe I'll have you on next time on my
podcast. When you're authentic, people listen closer. So it's so refreshing to hear the amount of energy and the excitement that you have for this, and especially given your background, how you came from a whole different angle, and it's like, no, this really can work, and these things can complement one another. It doesn't have to be one versus the other,
right,
and stuff. So hopefully we can get those insurance companies' attention and get them on board, and some trials with all of this to help that process. For our listeners, I always ask you to be a giver of hope. Like, click, and share. It's not about the numbers, never has been with us. It's about getting the information into other people's hands. They need to know what their options are. And that's a difficult thing to find out, because you don't even know what to ask for. So you don't know what to look for. So the more information that we can get out there and spread, people can listen to the podcast, they can watch the YouTube video, but, just share it with your world, because there's somebody out there needing this information that you might not even know needs this information. And what's cool with this is it's not just dementia specific. It can be used for so many different situations. Because who doesn't need their body to run better than what it is, currently? So again, you can go to their website, the HyperChargeClinic.com. Again, they've got locations in Maple Grove, Eden Prairie, and Woodbury, and the one in Edina is going to be a full health. So it's going to be your regular medicine model plus the integrative combined there, which is fantastic. You can find them on Facebook, Instagram, YouTube, TikTok, and Twitter, and we will have all those connections for you. And then also, I just want to give a plug for your podcast, which is Wellness at the Speed of Light, and your radio show, which is on AM 950, Recharging the Human Battery. So again, thank you so much for everything you're doing. I love your passion, your purpose, and most of all, your persistence to spread the word and make this world a better place. Give people a better quality of life. Everybody wants that. So thank you.
Thanks so much for having me. I look forward to talking a lot more with you in the future, and see how we can combine our efforts to help these people. People just need so much help, and you're absolutely right. Sometimes they just don't know where to turn. Mm-hmm. And just, your resources, my resources, when we're together, we're so much stronger at being able to get the word out on things that for whatever reason are hidden from people. And yes, I am passionate about it, and we get along so well because I share your passion for just helping people, and this has been wonderful being on the program today.
Well, thank you. And to our listeners, we'll see you next time. Bye now. So, in closing, I just want to remind you to visit alzheimersspeaks.com. We've got lots of great free educational resources there, and also our sister company, Dementia Map, which is a international resource directory. Has a lot of things on there you probably haven't heard before, and it also has a glossary of terms and a blog and an events calendar. So check it out. Thanks, everybody. Bye now.
Attention seniors, are you looking for a community that offers incredible benefits and stands up for your values? Look no further than AMAC. With an AMAC membership, you'll enjoy exclusive discounts on insurance, travel, dining, and shopping. Stay informed with 6 issues a year of our award-winning AMAC magazine, delivering trusted news and valuable insights. But that's not all. AMAC is committed to defending America's future by directly bringing the voices of our more than 2 million members to our elected officials. Join a community that cares about your needs and your values. For a limited time, we're offering a 1-year membership for only $1. Yes, just $1 for a year of incredible benefits and advocacy. Don't wait. Take advantage of this special offer and join AMAC today. Visit amac.us/join now. That's amac.us/join now.